Thank you, Mr. Chairman, and I respect and will honor your request to be as concise as we can be. Welcome. Good morning to you both. Bev, it's wonderful to be working with you again. And you have learned in the trenches, and that's what's going to make you so good at what you're doing with all these challenges. I'm going to step away, and I think you might be glad to take a breath and not exclusively talk about opt-in, opt-out on the expansion, although very important dialogue. I want to hear more from you than you hearing me telling you what I think. However, what I'd like to talk about specifically is one of the changes we made, and we've had some challenges over the board, and you'll have a lot more, but in the fiscal management services. Do you mind if we talk about that a little bit? It was a bit of a struggle, but a real, in the end, a good partnership between our district offices and what was going on in DPW, Office of Long-Term Care, under, if I understand this correctly, under a CMS directive to consolidate those agencies that paid for our direct care workers. Now, you've heard a number of times already, and you know it to be true, people want to stay in their own homes. And here in Pennsylvania, we've been able to do that, I think, with some great efficiency. So CMS asked us to take a look at the number of agencies out there that were paying the direct pay bill, right? Mm-hmm. So RFPs went out. We broke it down into 3 regions, and which was much more efficient to begin with, and then did an RFP, and it ended up being the same provider, right? Mm-hmm. So we refer to that as PP&L, public, private, whatever they are. But at any rate, that transition, which started in January, critically important. These direct workers need to be paid fairly, and certainly need to be paid on time. There were a multitude of reasons that we heard in our district offices why that wasn't happening on time. Now, it only started January 1, understand. It's a relatively short period of time. On the positive side, I want to compliment your department and also this particular agency, because every time someone called us, and it was numerous, there was a million reasons, seriously, why they weren't getting paid on time as they thought. They either didn't have the right information, they didn't have it in time, they said they didn't get their packets. I mean, it was a variety of reasons. We would help them in my district office, as I'm sure many of the others did. Every time we talked directly to your folks, mm-hmm. we actually talked to the agency people. Now, those numbers and questions have fallen back tremendously. It would look to me like this transition is finally going into place. Not that you can go back and do over, but can you help us understand how that all happened? I know the 37 other agencies that were handling the payroll before were supposed to get all the relevant and particular information. What I saw was they didn't always get that to the people, and then the direct workers weren't educated as to what they were supposed to do. So it wasn't so much a phone wasn't being answered, it was there were so many different issues. How many direct workers do we have under that particular system?
Do you know the number? I don't know. It's about 17,000. And Representative, you framed the issue exactly as it should have been. Everything that you just said is our understanding as well, and I truly appreciate that you acknowledged my staff. I would have liked to, I didn't do that at the beginning, and I should have. We do have tremendous staff. I've never met people that are more dedicated and hardworking than I have at DPW. And if it helps any, right now, those who have submitted accurate timesheets have been paid. So I think that's an important piece. The turnaround for payment is 2 weeks. There were a lot of issues. It was not a smooth transition. If you were one of the 37 who were to submit the paperwork and you moved to just one provider, there wasn't a lot of incentive to do that in an accurate and the correct way all the time. The Auditor General, the new Auditor General, will be coming in to do an audit of the process to see what worked, what didn't, and that will provide you all, as well as us, with information. And hopefully we're going to learn from that and do a better job if we do other changes like that. So I think you framed it exactly as it was.
Well, I appreciate the efficiency. I really do, and the great effort. Is this saving us money when we look in the budget? I mean, it's obviously it's going to be far more efficient to run and to audit from the inside, but will it save money as well?
It wasn't implemented as a budget
I know.
savings initiative. However, through
I like to save money.
the contract, we are able to pay a lower rate to PPL than we have the previous contractor, so it does save some money in the budget.
Well, I thought possibly that was the case. Also, I just noted, and I just realized this, that you had, or I guess the company itself, PP&L, put together a group of people,
Yes.
consumer-based with DPW. What's the intent? Is that a short-term look at how this was done, or is it an ongoing, input opportunity? What's the
It
purpose
is.
of that?
It's Representative, it's an ongoing input opportunity so that the company is reaching out to the stakeholders to make sure they are doing the best job possible. The most important thing about all of this is that the consumer has the service, and we want to ensure that the people, the direct care workers who are doing the job, get paid. So again, with the Auditor General coming in, I think we can all be assured that we're going to have some good answers of what did happen and why the transition was not as smooth as we would have liked. But right now, we are in a good place. There are still some people who are not getting paid, but if they're not putting their Social Security number on the timesheet, if they're not putting their tax ID, then they can't be. But PPL is reaching out to these people, educating them and working with them. And I think with the work group, that's what you're going to see more of. What else can we do? Is there a better way? Can we streamline the process? Is the paperwork too much or too difficult? So it's really taking a hard look at the work that's being done. Can we do better?
I was hoping that would be in kind, sort of an education piece that did seem to maybe be, if not missing, it was lacking a little bit in people understanding what they had to do. So actually,
Absolutely.
the time frame has not been that bad, so I compliment that. And I end with, again, thanking your folks, and also the agency has worked well with us. So
Thank
you have a
you.
big job ahead of you, and we're talking about the numbers to be served. All of this has to work right. So thank you. We'll all pray for you.
Oh, thank you.